Okay, this is the recording for Chapter 8, Cardiovascular System. There are three major types of vessels in the cardiovascular system: the arteries, capillaries, and veins. We'll talk about each one of those. Arteries are the vessels that carry blood away from the heart to the body tissues and organs. So they are the vessels that carry the oxygenated blood to drop off to the body extremities and all the body tissues to oxygenate them. Capillaries then are the microscopic vessels that join the arterial system with the venous system. The veins then are the vessels that return the blood to the heart to be reoxygenated. So the way I remember it is A, arteries carry blood away. Away has an A. And then V, veins visit the heart. So the arteries are taking oxygenated blood away to all the body parts. Veins are returning it after it's been circulated. The heart has three tissue layers, and you should be able to break these down based on the prefixes in terms of figuring out what it is. So the endocardium, endo means inside or within, so cardi means heart. The endocardium is the serous membrane that lines the four chambers of the heart and the valves. The myocardium then is the muscular layer of the heart. Myo is a combining form we're going to learn means muscle. And then epicardium, epi means above or upon, so that would be the outermost layer of the heart. Blood pressure, you have all heard of blood pressure, and you go to the doctor and they say, oh, your blood pressure is 120/80. And they say, well, that's good. But do you really understand what those numbers mean? Well, blood pressure is the force exerted by blood against the arterial walls during two phases of the heartbeat. The systole or systolic number is the top number, and that is the contraction phase in which that has the most exerted force against the vessels. So when the heart pumps and it rushes out that big surge of blood, the amount of tension that are inside of the arteries is that number measured in millimeters of mercury. And then as the heart relaxes, then that's the diastole or the diastolic number, the bottom number. And that's when the weakest exerted force is inside of those vessels. So the systolic number is the heart at work, and the diastolic number is the heart at rest. So systolic is the top number, diastolic is the bottom number. Pathology that we see: hypertension, high blood pressure. And so it depends on the patient as to what we determine to be high blood pressure. But textbook-wise, your book talks about anything that is, or any blood pressure that's consistently or persistently 150/90 or above is considered hypertension. Hypotension then is low blood pressure. Any pressure that is consistently 90/60 or below is considered low blood pressure. So hypertension, hyper means excessive or above, so that's high blood pressure. Hypotension, hypo means under or below, so that's low blood pressure. The next thing that the book talks about is a myocardial infarction. A myocardial infarction is basically just a fancy name for a heart attack. And so, symptoms that a patient may have if they're having a myocardial infarction: they may have what's called angina or angina, and that is the medical term for chest pain. Sometimes this is pain, and sometimes it's pressure in the chest. Dyspnea, we learned in the respiratory system, means difficulty breathing. They may have diaphoresis, which means profuse sweating, like they break out in sweat all over their body, not just a couple trickles of sweat like what we do when it gets hot outside. They have pallor, and you'll remember that term from the integumentary system. Pallor was an unnatural look of paleness because all of the blood is going to the vital organs. Tachy or bradycardia. So if you remember your prefixes, tachycardia would be a fast heart rate, bradycardia would be a slow heart rate. So it could go faster, it could go slower. Now, these are the textbook signs that they talk about for heart attacks, but you probably have heard some as described by patients who have pain in their left arm, pain in the left arm that radiates up into the jaw. Sometimes it could be pain between the shoulder blades. In the emergency room, I would hear some men come in and not say that they had chest pain per se, but a lot of pressure. Like one guy told me he felt like he had an elephant sitting on his chest. So it was just an immense amount of downward pressure. So if any of those symptoms are going on, then the patient needs to seek treatment right away. Heart attacks occur when the blood supply to part of the heart muscle is severely reduced or cut off altogether. So most likely there's a blockage in one of the coronary arteries that is feeding the blood into the heart. And so if the heart is not getting adequate amount of blood, then there's going to be the heart attack, which is going to be some damage to the heart muscle itself. This slide talks about symptoms including chest pain lasting more than a few minutes, pain in the arms and neck, sweating, shortness of breath, and lightheadedness. If you turn in your book to page 223, we'll go through the diseases and conditions that you need to know for this chapter. And the first one is aneurysm. An aneurysm is a localized abnormal dilation of a vessel, usually an artery. You don't need to know the difference between the fusiform and the saccular. Just know that an aneurysm is a dilation of a vessel. Now, as long as this vessel doesn't get any larger and it's not causing any problems, some patients can go on for long periods of time with aneurysms as long as their blood pressure remains normal. But you can see that if their blood pressure goes high and they have a weakened vessel, that's where we have problems, because that aneurysm can dissect or burst, and then they can have a bad problem depending on where it is, if it's in the brain or if it's in the trunk of the chest, the aortic. An aortic aneurysm is very deadly. The term cardiomyopathy, after studying the word parts, you should be able to just break this term down. Suffix pathy means disease, cardio means heart, and myo means muscle. So it is a disease or weakening of the heart muscle that diminishes the cardiac function. The term hyperlipidemia, you can break this term down as well. Hyperlipidemia, emia means condition of blood, hyper, excessive or above, and lipid means fats. And so hyperlipidemia is excessive amounts of lipids, the cholesterol, phospholipids, and triglycerides in the blood. Hypertension we talked about is an elevated blood pressure persistently over, your book actually changed it to higher over 140 over 90 millimeters of mercury. And then hypotension is low blood pressure persistently over 90 over 60. So hypertension, your book says 140 over 90. I said 150 in the previous comment. And then ischemia. Ischemia is a local and temporary deficiency of blood supply to an organ or tissue due to a circulatory obstruction. So ischemia occurs when a patient's having a heart attack because there's a portion of the heart that's not being vascularized. Medical, surgical, and diagnostic procedures from page 228. Actually, the first one looks like starts on 229. Angioplasty. Angioplasty is any endovascular procedure that reopens narrowed blood vessels and restores forward blood flow. So, in the case of the blocked artery, they show a picture in your book on page 229 of an angioplasty, and that's a balloon angioplasty where they insert a catheter into the blocked vessel, they inflate the balloon, and as they inflate the balloon, that squishes the fatty plaque up against the sides of the arteries, and then it reopens the vessel so that there is adequate blood flow through that. Another procedure that they can do to treat blockages of the heart is coronary artery bypass graft, and they show a picture of that on page 230. So if there's a blockage that's significant in the heart, they will go to the lower leg and they will harvest a vein and bring it up to the heart and then create a detour around the blocked vessel. So if you hear a patient say, I had a triple bypass, that means that 3 areas in their heart were bypassed or grafted with a vein from their leg because they had 3 separate blockages. Electrocardiography is basically a fancy name for an EKG, and an EKG is basically just checking, or excuse me, tracing the electrical activity of the heart. And so it's a procedure that graphically records the spread of electrical excitation to different parts of the heart using small electrodes applied to the chest, arms, and legs. So an EKG will show us the rhythm of the heart, and it'll also show us if there's any changes that would lead us to believe that there might be a blockage. Abbreviations that you need to know from page 239. The first one, BP, stands for blood pressure. CABG, coronary artery bypass graft. CAD, coronary artery disease. HTN, hypertension. MI means myocardial infarction, not that state up north. And US stands for ultrasound. Spelling words taken from the word analysis. The first word is tachycardia, which is a rapid heartbeat. Myocardial, the heart muscle. Embolectomy, excision or removal of a clot. Angioplasty, surgical repair of a vessel. Aortostenosis, narrowing of the aorta. Atheroma, tumor of fatty plaque. And thrombolysis, separation, loosening, or destruction of a clot. You are responsible for memorizing the word elements and their meanings on pages 216 through 219, so that's where you're going to make your flashcards. Several quiz questions do come from these, and you're still going to need to continue to memorize those so that you will be prepared for the midterm exam. Here ends the recording for Chapter 8, Cardiovascular System.